GRIP are a group of multi-specialist professionals who were brought together with an aim of reducing inappropriate antibiotic use. They aim to reduce inappropriate antibiotic use by providing a consistent global approach to help manage behaviour change and advocate a symptomatic relief for upper respiratory tract infections. Being a member of the Respiratory Tract Treatment Forum, I've been involved in similar campaigns to what GRIP provides in Ireland at a national level. I've also conducted a significant amount of research at a local level in GP practices that I have worked in that has aimed to reduce antibiotic use in Ireland and has been very successful. I also was the winner of the ICP AVIVA Quality and Practice Award for my study which reduced antibiotic use in Irish general practice through the use of a patient information leaflet. Respiratory tract infections are a very important target for reducing antibiotic use, as respiratory tract infections account for a large proportion of antibiotic prescriptions, as they account for a large proportion of primary care consultations. Therefore, if we can aim to reduce the consultations for upper respiratory tract infections, we can hopefully then reduce antibiotic use for these infections. We need to signpost patients to attend their pharmacies and try to advocate a symptomatic relief mechanism. There are a number of different challenges faced by general practitioners when they are seeing a patient with an upper respiratory tract infection. Firstly, the general practitioner needs to explore the reason that the patient is attending them with their symptoms of an upper respiratory tract infection. This may actually reduce inappropriate antibiotic prescribing. GPs often overestimate the patient's desire for an antibiotic and therefore feel that the patient will not be satisfied with the consultation unless they receive a prescription for an antibiotic. Patients from my study, I have found, often attend for other reasons, which include things like receiving a certificate for work, improving symptom management, and also clarifying the diagnosis. So once this communication barrier has been solved and the GP knows the reason that the patient is attending them, the management becomes much more simple. GPs also have issues with consultation time pressures. GPs are very busy and only have a set length of time to spend with each patient. Sometimes GPs feel that to have a discussion around appropriate use of antibiotics, it will take too much time and the patient will therefore eat into the next patient's appointment time. I would advise doctors who are dealing with patients who have upper respiratory tract infections to try to ascertain immediately why the patient has attended. Try to outline their expectations of the consultation, what it was the patient actually wants to achieve. If the doctor and the patient have the same final common goal, the consultation will be much easier. I advise that doctors should direct patients towards the pharmacy to find symptomatic relief for their upper respiratory tract infections, and also try to educate the patient regarding the management of future upper respiratory tract infections at that time. There's an excellent suite of materials available online currently on the website www.grip-initiative.org. These include toolkits and the Bob video. There are a number of benefits in using materials in discussions about upper respiratory tract infections with patients. In my own study, I used a patient information leaflet to try to reduce antibiotic use in general practice, and this proved to be very successful. Not only was the prescription for antibiotic reduced, but also reconsultations were reduced and the mean consultation time was reduced. Having a physical item that can be handed over to the patient, like a viral prescription, serves as an excellent tool to educate the patient. They can read it at home and educate their families. And also it's another way to end the consultation, similar to how using an actual prescription often is the way that GPs end the consultation.